Bismillahirrahmanirrahim. The quote of the day is life is like a riding a bicycle. To keep your balance, you must keep moving. Today, the topic of presentation is foodborne diseases and food toxicants under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is introduction to foodborne disease, global updates, classification of foodborne illnesses, food infections, food intoxication, transmission of foodborne disease, prevention, and at the end are the recent updates and MCQs. By the end of this presentation, participants will be able to describe the epidemiology and prevention of foodborne illnesses. Now, what are foodborne diseases? Are diseases usually either infectious or toxic in nature caused by agents that enter the body through the ingestion of food. With the increase in urbanization, industrialization, tourism, and mass catering systems, foodborne diseases are on the increase throughout the world. The etiology of foodborne diseases. Foodborne diseases are those diseases that are result of exposure to pathogenic microorganisms such as bacteria, viruses, and parasites. We tend to have acute effects on human health. Where chronic and in some cases acute foodborne illnesses may also be caused by the presence of various chemical substances that enter the body intentionally or intentionally. That includes residents of pesticides and veterinary drugs, unlawful food additives, mycotoxins, biotoxins, and radionuclides. The classification of the foodborne diseases, they are mainly classified into foodborne infections and foodborne intoxications. No foodborne disease infections include bacterial, parasitic. Bacterial include typhoid, cholera, bacilli, dysentery, salmonella, and others, while parasitic include ascariasis, amoebiasis, trichomoniasis, and others. While food poisoning or food intoxication includes bacterial, and that include the toxins of bacterials like Staphylococcus, Clostridium botulinum, and Streptococcus. Plant and animal intoxications include some mushrooms, mussels, herbs, and others. While chemical or accidental includes arsenic, lead, cadmium, cyanide, antimony, nitrates, and DDT. Now the facts of the World Health Organization about the foodborne diseases. The burden of foodborne disease is substantial. Every year, foodborne disease cause almost 1 in 10 people to fall ill and 33 million healthy lives years lost. Foodborne disease can be deadly, especially in children less than 5 years of age, and it causes about 4,20,000 deaths in children. And children account for 1/3 of the deaths for the foodborne disease. Foodborne diseases are preventable. Everyone has a role to play. Unsafe foods containing harmful bacteria, viruses, and parasites or chemical substances cause more than 200 diseases, ranging from diarrhea to cancers. An estimated 600 million, almost 1 in 10 people in the world fall ill after eating contaminated food, and also 4,20,000 die every year, resulting in the loss of 33 million healthy life years. About 110 US billion dollars is lost each year in the productivity and medical expenses resulting from unsafe food in low and middle income countries. Children under 5 years of age carry 40% of the foodborne disease burden, with 4,20,000 deaths every year. Diarrhea disease are the most common illnesses resulting from the consumption of contaminated food, causing 550 million people to fall ill and 2,30,000 deaths every year. The burden of foodborne diseases. In 2015 WHO report on the estimates of global burden of foodborne disease presented the first ever estimates of disease burden caused by 31 foodborne agents that are caused by the bacteria, virus, parasite, toxins, and chemicals at global and regional level. In 2018, World Bank report on the economic burden of foodborne disease indicated that the total productivity loss associated with foodborne disease in low and middle income countries was estimated to cost $95.2 billion every year, and the annual cost of threatening foodborne illnesses is estimated to 15 billion US dollars. For the safe food imperative, accelerating progress in low and middle income countries, in that is published in 23rd October 2018. Unsafe food costs low and middle income countries 110 billion US dollars in loss of productivity and medical expense a year. Preventive measures including greater investment, better regulatory frameworks, and measures that promote behavior change can help countries avoid food safety problems. An inclusive approach to food safety management that makes food safety a shared responsibility among government, farmers, food businesses, and consumers will be most effective. No, food safety is a public health priority. Every year, 20 million children contract diarrhea disease and 96,000 die. The International Conference of Food Safety held in Addis Ababa in February 2019, and the International Forum on Food Safety and Trade held in Geneva in 2019 reiterated the importance of food safety in achieving the Sustainable Development Goals. Food safety is integral to the Sustainable Development Goals. Food safety is critical to achieving the Sustainable Development Goals. Food safety is integral to the Sustainable Development Goal number 1, 2, and 3. That is no poverty, zero hunger, good health and well-being. And food safety practice contributes to Sustainable Development Goals 5, 6, 8, and 11. That is gender equality, clean water and sanitation, decent work and economic growth, and sustainable cities and communities. Food infection can be due to bacteria that may be examples include salmonellosis, gastroenteritis, shigellosis, and viruses that include poliomyelitis, infectious hepatitis, and parasites that include amoebiasis, trichinosis, and tapeworm infection. No, these are the 7 big foodborne pathogens. These are norovirus, and there is no licensed vaccine against norovirus. Hepatitis A virus, the vaccine available is single dose hepatitis A vaccine. Salmonella, the vaccine available are TY21A or VI capsular polysaccharide and conjugate typhoid vaccine and Shigella, and there are no licensed vaccines available as E. coli. Uh, Strains are O157H7. Vaccinations for E. coli is also not present in market. Listeria and Toxoplasma. These are the big 7 foodborne causing pathogens. Now, these are the signs, symptoms, and other complications caused by these pathogens. The Bacillus cereus, first pathogen is Bacillus cereus. The incubation period 4 to 16 hours, and the symptoms last for 12 to 24 hours. There is diarrhea, vomiting, and abdominal pain in it, and we need to stay hydrated in it. The other is the Clostridium botulinum, that the incubation period is 2 to 4 hours, and it lasts for weeks. And in most cases, severe cases, it lasts for weeks. There is in it there is sometimes diarrhea and sometimes vomiting, and the uh, symptoms that included in botulinum poisoning is blood vision, difficulty swallowing, slurred speech, dry cough, respiratory failure. The distinguishing feature of Clostridium botulinum intoxication is that it affects the central nervous system. That's why we have blurred vision, difficulty swallowing, and slurred speech. The possible complications include long-term hospitalization in severe cases, and if we get botulinum intoxication, we have to get medical help immediately, and we will be rather prescribed antitoxins for the botulinum and antibiotics, and it is mostly caused by consuming the canned foods. Next is the Clostridium perfringens. The incubation period is 8 to 24 hours and seem to last for 1 to 2 days. In it, mostly diarrhea occurs. The other is the E. coli. Incubation period is 8 to 44 hours and symptoms last for 3 to 7 days. In it, there is diarrhea and vomiting. The other is Salmonella. The incubation period is 12 to 72 hours and symptoms last for 4 to 5 days. In it, there is diarrhea, vomiting, abdominal pain, and fever. And there is also chills, nausea, pain in the joints, headache, muscle pain, and malaise. The complications included are reactive arthritis, irritable bowel syndrome. Next is the Vibrio cholera. In it, the incubation period 4 hours to 4 days, and the symptoms last for 2 to 6 days. And there is diarrhea, vomiting, and uh, abdominal cramps, and it we have to stay hydrated. Now the food intoxication. Intoxication occurs from eating a food that contains a toxin produced by bacteria. An example of food intoxication is Clostridium botulinum poisoning. Intoxication occurs when live bacteria cells are ingested, which then produce toxins in the body. Food-related illness fall generally into two categories, that is intoxication and infection. The term food poisoning applies most readily to the type of illness caused by toxin that may be in the food we eat. Types of intoxication. These include bacterial intoxication, fungal, chemical, plant, and poisonous animals. Bacteria intoxication. There are four chief bacteria which cause the food intoxication that includes Staph aureus, Bacillus cereus, Clostridium perfringens, and botulinum. These are the features of the toxin producing bacteria, that is staphylococci. It comes from the nasal passages of the animals and people. Therefore, people with colds, etc., had meat of the animals, other meat to a lesser degree, and effects include the intoxication severe, yes, and it may be severe from slight to moderate, and onset is rapid 2 to 8 hours. Salmonella, Yersinia, and Campylobacter. It comes from the intestines of the animals and people. Meat becomes contaminated at the carcasses dressing stage. Some people may be carrying Salmonella themselves without symptoms and may infect meat. Its effect includes moderate to severe, fatal in extreme cases, for example, in children and old age. Onset is slow and symptoms last for 12 to 24 hours. The next is the Clostridia. It comes from the soil, therefore, in dirt associated with animals species. So it in severe cases caused by Clostridium perfringens and moderate caused by the Clostridium botulinum, and it may be fatal. Onset is moderate to slow and it lasts for 8 to 24 hours or longer. Know the difference between the foodborne infections and intoxication. Foodborne infections are mostly caused by bacteria, viral and parasite and protozoa, while intoxications are caused by toxin that are natural or preformed bacterial toxins or chemical. Infections invade and multiply in the lining of the intestine. Incubation period is 2 days, and symptoms include diarrhea, nausea, vomiting, abdominal cramps, and fever. And it may be communicable, spreads from person to person, and factors inadequate. The factors that contribute to infections include inadequate cooking, cross contamination, poor personal hygiene, and bare hand contents. While the in intoxications, there is no invasion or multiplication of the toxins. Incubation period is much shorter than the infection, that is minutes to hours, and signs symptoms include vomiting, nausea, diarrhea, weakness, respiratory failure, numbness, sensory motor dysfunction, and they are not communicable. Factors that contribute to intoxication include inadequate cooking, improper handling, and temperatures. Improper handling temperatures. Dangers of foodborne disease individual include loss of family income, medical expenses, cost of special dietary needs, death of funeral expense, loss of customers and sales, increased insurance premiums, lowered employee morale. Epidemiology. Many foodborne illnesses are not recognized or go unreported for a variety of reasons. First, routine surveillance may not detect a mild foodborne illness. Second, some of the same pathogens that cause foodborne illness can also be transmitted in water or from person to person. Lastly, some pathogens are emerging and are not yet identified or able to be diagnosed. Considering these factors, the above listed number of illnesses, hospitalizations, and death may be obsolete. Main causes of foodborne diseases. This may be due to cross contamination occurs when microorganisms are transferred from one surface or food to another. For example, by mixing the cooked and uncooked food. Time temperature abuse happens when the food is exposed to temperature danger zone, that is a 41 degree Fahrenheit to 140 degree Fahrenheit for more than 4 hours. This is a dangerous temperature zone, and if the food is kept in this temperature range for more than 4 hours, the food may become contaminated and unhygienic for consumption for eating. Poor personal hygiene, food handlers are carriers of disease causing bacteria. Food service personnel can contaminate food. Know the transmission. Transmission of foodborne pathogens occur by oral route. How those pathogens contaminated food can vary based on the organism, its reservoir, food handling, processing, and cross contamination prior to serving. Some organisms rely on a food human reservoir such as Norwalk like virus, Shigella, and Campylobacter. Others have an animal reservoir such as Campylobacter, Salmonella, E. coli, Listeria, and Toxoplasma. Contamination can occur at several points along the food chain, on the farm or in the field, at the slaughter plant, during processing, at the point of sale, or at home. So the prevention includes primary prevention and secondary prevention. Primary prevention includes health promotion and specific protection. The four key recommendations for food safety are check, clean, separate, cook, chill, and took away. No recommendations to for cleanliness. That is the hand washing practice. These are the steps in outline for proper hand washing. Step one is you need a soap and water. Then you have to rinse your palm to palm, and then between the fingers, then the back of the hand, then thumbs, then back of the fingers, then fingernails, and then the wrist. This is the proper hand washing technique. Then wash your hands. Hand washing is the most effective way to stop the spread of illness. Now, how to wash hand? Wet hands with water, soap, and scrub for 20 seconds. Rinse under the clean running water. Dry completely using a clean cloth or paper towel. Wash hands after using bathroom or changing diapers, sneezing, blowing nose or coughing, touching a cut or open sore, handling food handlers, pets. No, clean during food preparation. Wash cutting boards, knives, utensils, and countertops in the hot spray water after preparing each food and before going to the next. Avoid spreading bacteria. Use paper towels or clean cloths to wipe up kitchen surfaces or spills. Wash clothes often in the hot cycle or your washing machine and dry in the hot. No personal hygiene. Wash your hands frequently. Take bath. Brush your teeth twice a day. Floss your teeth daily. Floss means to clean the space between the teeth by using a thread. Take care of your nails, wear clean clothes, cover your mouth when you cough or sneeze, get restful sleep, create a routine, visit the doctor if you get any illness. Second recommendation is to separate raw, cooked, and ready to eat foods while shopping, preparing, or storing foods. Use different cutting boards. Use one cutting board for for fresh produce and a separate one for raw meat, poultry, and seafood. Use clean plates. Never serve foods on a plate that previously held raw meat, poultry, or seafood unless the plate has first been washed in hot soapy water. Third recommendation is to cook. Cook foods to a safe temperature to kill microorganisms. Cook chicken and turkey, that includes whole birds, legs, thighs, and wings, to 165 degree Fahrenheit. Cook beef, lamb, veal steaks, roast to 160 degree Fahrenheit for medium doneness, 145 degree uh, for medium rare. Fourth recommendation is chill. Chill perishable foods promptly and defrost foods properly. Perishable foods includes those foods that get contaminated shortly after preparation. The 2-hour rule. Refrigerate perishable foods within 2 hours at a refrigerator temperature of 40 degree Fahrenheit or lower. Foods include meat, poultry, fish, eggs, tofu, dairy products, pasta, rice, cooked vegetables, fresh peeled cut fruits and vegetables. Danger zone. On a hot day that includes 90 degree Fahrenheit or higher, food should not leave out for more than 1 hour. Bacteria multiply rapidly between 5 to 60 degrees centigrade or 40 to 140 degree Fahrenheit. Recommended refrigerator and freezer temperatures are 40 degree Fahrenheit or lower. No specific protection. Currently available vaccines for foodborne disease causing organisms are for hepatitis A, that is the single dose hepatitis A vaccine, salmonella, that is TY21A, RVI, capsular polysaccharide or conjugate vaccine. And there is no still licensed vaccine against norovirus, Shigella, E. coli, Listeria, Toxoplasma, and norovirus. No tool for diagnosing foodborne illnesses, according to CDC. It is important to understand routine specimen collection and testing procedures and to know when and how it's appropriate to make special test requests. Some complex tests may only be available from large commercial or public health laboratories. Possible diagnostic tests include stools culture indicated if patient has a fever or it is immunocompromised, patient has bloody diarrhea or severe abdominal pain, illness is severe or persistent. Stool examination for parasites indicated if patient has a travel history that suggests the possibility of parasites, patient is immunocompromised, diarrhea is chronic, persistent, or unresponsive to appropriate antimicrobial therapy. Gastrointestinal tract illness appears to have a long incubation period. Blood cultures indicated if bacteriemia systemic infection is suspected. Direct antigen detection tests and molecular biological techniques. It is available for rapid identification of certain bacterial, viral, and parasitic agents in clinical specimens. Sometimes microbiological and chemical testing for of vomiters or food items are warranted. For more information, consult an appropriate medical specialist, clinical microbiologist, or state public health laboratory. Know the treatment. In most cases, you can treat food poisoning by replacing low fluids and electrolytes to prevent dehydration. In some cases, over-the-counter or prescription medicines may help. You can prevent some food poisoning by properly storing, cooking, cleaning, and handling foods. Simply, rest is one way to help your body heal from food poisoning. Take it easy until you are feeling better. Additionally, do not eat or drink for a few hours after the onset of symptoms. When you do start eating and drinking again, try gentle and bland foods like crackers and sports drinks. Know the time for the recent updates. The first article is a systematic review on shifting trends of foodborne disease in Pakistan. This review identified career agents of foodborne disease, which was particularly high in Karachi due with high influx of patients, consequently due to advanced treatments or overcrowding that disseminate the disease more commonly. Second, being the largest province with population in Punjab, where high rates of foodborne pathogens were isolated, followed by KPK, Gilgit, and Balochistan, where low-income, low-populous refugee influx, lack of proper sewage system thrived the disease, and most of which remain unreported. The largest factor in contributing the foodborne ailments were lack of hygiene and resistance to antibiotics. Furthermore, self-medication without a prescription and overuse of antibiotics are important factors possible for development of resistant strains. Now, Pakistan food safety challenges. Burden of severe foodborne disease in the economies underdeveloped countries. Pakistan is an underdeveloped country in which food safety and hygienic conditions have been ignored for a long time, and hence the occurrence of many pathogens in different food is common. Estimating foodborne disease in Pakistan is a tough job because any monitoring or infection control program is absent yet. Unhygienic processing practices and poor storage of milk, cereals, nuts, and other foods are a major cause of fungus and bacterial contamination like aflatoxin and others. Foods are contaminated by heavy metals as manifested by numerous studies. Continuous increase in population greatly affects the economy of the country that eventually degrades food materials offered for promotion to get higher profit, ignoring the quality and safety regarding those products. Therefore, increasing the trend of adulteration in foods like milk possesses a serious trend for the government during the past few years. The review is demanding topic to explain the scenario of the present food safety issues in Pakistan. The review is furnished with information from local and related international studies. Now the time for the MCQs. First MCQ is a 32-year-old male presented to OPD with complaint of blurring of vision, slurred speech, difficulty in swelling, and breathing issues. The method of successful treatment of botulism prior to appearance of botulism symptoms involve administration which of the following, whether the antibiotic, analgesic, antitoxin, antipyretic, or antiviral.
B.
Yes, C, antitoxin is the correct option because in botulism it causes food poisoning by its toxins. So the treatment involves the antitoxin. Second MCQ is a group of 20 people presented to emergency with symptoms of severe abdominal discomfort, diarrhea, and dehydration. Upon investigation, it was found that they consumed food from a wedding party before developing symptoms. Doctors consider the cases as food poisoning. A confirmed case definition of such illness might include all of the following except whether the symptoms of the illness, laboratory test result, time of presentation, duration of illness onset, or consuming food from a common place. C, time of presentation is a correct option because many foodborne diseases have different uh, incubation periods, so time of presentation is not included in a case definition of food poisoning. Third MCQ is a team of investigators is formed to investigate the outbreak of Salmonella typhi outbreak in a specified region. Which of the following is not primary goal for undertaking foodborne disease outbreak investigations? Whether study the natural history of causative agent, train staff, stop the current outbreak by implementing effective control measures, stop laboratory diagnosis for cost effectiveness, finding the possible source of poisoning, which is not included.
C.
Delta stop laboratory diagnosis for the correct effectiveness, while others are included. C option is stop the current outbreak by implementing effective control measures. For food poisoning outbreak, we have to accomplish this step. Fourth MCQ is a water stool sample was collected from a 5-year-old boy who is suffering from diarrhea for 2 days. Smooth and round colonies were observed after the incubation in high pH media containing NaCl. Microscopic examination revealed gram-negative motile commercial bacteria. Name the possible bacteria. Whether it is Aeromonas species E. coli, Helicobacter H. pylori, Vibrio cholera, or Staph aureus.
D.
D. Yes, Vibrio cholera is the correct option, as it is a motile gram-negative comma-shaped colony-forming bacteria. Fifth MCQ is two male college roommates travel to Costa Rica, that is a country in Middle America, for spring break. At their hotel, they ate fruit salad and drink bottled water with ice. The next evening, they both noted abdominal cramps, slight fever, and watery diarrhea that recurred several times during the night. The hotel doctor gave them antibiotic and oral rehydration salts. What pertains best to their illness? Whether this could be caused by a virus such as rotavirus that produce an enterotoxin, or Vibrio cholera that attach to the mucosa and secreted a toxin that increase the intracellular cam. A bacterium in the food invaded intestinal epithelial cells and secreted a toxin that inhibited protein synthesis. This could be caused by a protozoa such as Giardia or Entomoeba that damage the microvilli and intestinal mucosa, or the rotavirus primarily infects enterocyte and induces diarrhea through the destruction of absorptive enterocyte leading to malabsorption.
B.
Yes, B. These symptoms are pertaining to the Vibrio cholera infection, and it is its mechanism of action when it attached to the mucosa and secretes toxin that increases intracellular cam. Sixth MCQ is a 20-year-old female presented to OPD with complaint of numbness in hands, slurring speech, blurring of vision, and respiratory distress. She gave a history of consuming canned food. A deadly foodborne illness from improperly canned foods is caused by whether Trichinella, Salmonella, Clostridium perfringens, Clostridium botulinum, or Vibrio cholera.
A.
The hint in this MCQ is the involvement of the central nervous system and canned foods. Uh, it is caused by the Clostridium botulinum, by the toxin of the Clostridium botulinum. So the correct option is D. A 15-year-old boy presented to OPD with the complaint of cramps, fever, and frequent blood-tinged stools. On taking history, it was found that he went to a restaurant for lunch. Noting that the baked chicken he ate was pink and undercooked. His symptoms were 3 days after eating lunch. What might be the probable cause of illness? Whether he is stable enterotoxin produced by enterotoxigenic E. coli, meat contaminated by enterogenic E. coli, meat contaminated by a restaurant worker sick with Shigella dysentery, meat contaminated by Campylobacter jejuni, undercooked meat causing gastric upset. Which is the correct option?
C.
Yes, C is the correct option. As the patient developed symptoms after eating a undercooked food, so it is contaminated by the meat is contaminated by a worker who has a Shigella dysentery, who do not kept his personal hygienic measures adequately. Eighth MCQ is a group of travelers suffer from symptoms of severe food poisoning during their trip to Hawaii. Keeping in mind the common source of infections, what is the most probable vehicle in terms of foodborne illness? Whether a non-living source of pathogens that infects large number of individuals, or a living source of pathogens that infects large number of individuals, any disease that can be directly passed from an animal to human, or a host in which a pathogen grows and matures but cannot reproduce, or a host with weak immune response. The hint is
B.
to the vehicle, which is the most common source of probable vehicle. The correct option is
A.
alpha. Yes, alpha, non-living source of pathogens. When some food is contaminated by any microorganism or toxin, that is the non-living source, such as meat, dairy products, others. Ninth MCQ is bacteria multiply quickly in food temperature danger zone. What is the temperature zone range for this zone? whether 30 to 130 degree Fahrenheit, 45 to 145 degree Fahrenheit, 40 to 140, 40 to 150, or 50 to 120 degree Fahrenheit.
A.
C Charlie, 40 to 140 degree Fahrenheit. This is the danger temperature zone. When food is kept at this temperature for more than 4 hours, there is the chance of contamination of the food. So food should be kept below 40 degree Fahrenheit. Food poisoning can most effectively be prevented by which of the following safety steps: whether leave food outside to thaw, store food temperature at 50 degree Fahrenheit in the refrigerator, washing hands thoroughly and frequently, rinsing meat before cooking, or keeping raw and cooked food together. Which is the correct option?
B.
C.
C.
Yes, C is the correct option. Washing hands thoroughly and frequently. This is the last MCQ. This is the key of my MCQs, and thank you very much.
Thank you very much, Dr. Awais. Very nice presentation, especially you have very wonderfully covered the important aspects of food poisoning and how the different temperatures they are related with food preservation and for food safety. Thank you very much. Very well done. Allah Hafiz.
Thank you, ma'am. Allah Hafiz.